So let's get started today and talk about the exceptions training. So the exceptions training today is just one of many trainings that we are rolling out for that go under the umbrella of the Compass Project. So there are several areas of focus for Compass, and the exceptions process falls under the service group framework. And there will be very few changes to the process of exceptions, but there are some changes to the form. And so we're going to go through those today. So next, let's talk about the technology that we're going to be using today. So you'll see that none of us presenters are on video today. And so I just want to throw it out there that if you're comfortable being on video and you want to be on video, go ahead. We are recording these webinars, and playback can be a little distracting if people can see our faces. So we are off camera. The other thing to note is that everybody is muted today. And so one of the things that we're encouraging is that people hold their questions until the end. And there are a couple of reasons for that. One is that we want to make sure that we don't miss anybody's questions. Oftentimes today there's 150 plus people on here today. And so if lots of people are adding questions to the chat, there's a good chance that we might miss them, and we don't want to do that. The other reason for it is that we do have a question and answer session at the very end with our subject matter expert. And so we want to leave some time for that, but you also may get your question answered along the way. And so next we're going to talk about having some guidelines for participation. So even though there is not necessarily a lot of change happening with exceptions, there are a few changes happening with Compass. And so we're just asking that everyone listens with an open mind, be present and engaged. And again, this also goes back to if you have questions, a lot of this material might answer those questions. And so if you are present and engaged, those questions might get answered. The other one is to be respectful of others, honor each other's time and space. There may be questions that we're not able to answer at the end. So that being said, I want to note that we will have FAQs. And so we are gathering questions that come from the Q&As and putting out FAQs. And so if we are not able to answer your question here, it will get answered either in an FAQ, on the monthly calls that Rose will talk about. And so just know that there are going to be other opportunities for your questions to get answered. Then we're going to focus on what we can control and influence. There are a few things that we'll talk about today. One of them being the role that you will play in the exceptions process. And so that is something that you have control and influence over, and how that collaboration works. And then again, take care of yourself throughout. Like I said, feel free to turn off your camera if you want to. You can leave it on if you want to. Grab a cup of coffee, get comfortable, and just if you need to leave for any reason to take a break, go ahead and do that. And I think the other thing to note on this is that we do have some examples in here in the PowerPoint, and we wanted to stress that these are not representative, or they do not represent actual people in our system that we provide services to. These are completely fictional scenarios. So next, let's talk about how to get the most out of this session. It's really important to attend the entire session. Take notes if you have the participant guide, and that is available again in the chat. And then participate fully in the discussions and Q&A. We will just have the Q&A today. There are upwards of 165 people now. And so the Q&A is where we will have people hold their questions or ask their questions at the end of the session. And then at the very end, we have a post-course evaluation. This is not an evaluation of your learning today. This is an evaluation to help us determine how we roll out the learning, how we're presenting it, what worked best for you, what didn't work best. And we do review all of that feedback and use it to adjust and improve training that we roll out. So your feedback is really important to us. And we'll give you that link at the end of today. So then speaking of today, we're going to talk about some learning outcomes. And so the goal by the end of this workshop is that you'll be able to recognize the time frame for new 24-hour residential setting exceptions requests to be prioritized by July 1st. And we will have a timeline, and Rose will discuss that with you in a little bit. Identify the steps in the exceptions process. Identify key aspects of the new exceptions form. Recognize how exceptional rates are calculated, and identify components of the funding decision memo. All right. Moving on, we're going to talk about our intentions for this session. One is that we're hoping that you'll feel better informed about what is going to change and what will stay the same. So again, we talked about the exceptions process itself is not going to be changing, but there's a new form that Rose is going to go through, and she will talk about those specific dates for exceptions requests that need to be in to prioritize for the July 1st date. And then we're hoping that people will be better equipped to communicate this information accurately, constructively, and accessibly for all audiences. And so with that being said, I am going to hand it over to Rose, and she is going to discuss the areas of change with Compass.
Good morning, everyone. Thank you, Teresa, for that. So this whole presentation is going to be focused on exceptions in the process. Again, we want you guys to be comfortable with the information and then also have a level of comfort to where we can support individuals who receive services, their families, and our partners. And this whole process is really meant to be a supportive process. When I say that, I mean not only you all supporting individuals more directly in the service field, but also us as a state committed to supporting our provider field and our case management field, and then of course people who receive services. So nothing feels too scary or jarring or unsettling for people. We really want people to feel supported, informed, and reassured through this process. So that's really our goal here. I'm going to talk a lot about exceptions today, and it's going to be highly focused on the 24-hour exceptions. So you're going to hear a lot of information, and much of it is really going to be relatable to multiple types of services and settings. And that'll be more of the general information. But if it does feel like it's very kind of leaning towards 24-hour, it is, and with intention. And we'll talk more about timeframes and the whys and hows for that understanding as well. Another thing also is for those of you that have participated in some of our other Compass trainings, there's definitely some overlap or some things might feel a little bit redundant, and that's somewhat intentional. We want people to become familiar with these concepts so that when they're rehearing them, it's, oh yes, I remember now, or okay, I get that. And we're really reinforcing some of those core concepts with this training and this content. So I just wanted to kind of orient you guys to that and have you prepared. Our Compass areas of change that we have are kind of some three key components where we focus on what we call our work project or our work streams. We talked about the ISP redesign in that general Compass training. There's some big efforts happening there. That's a longer term project in some ways, as in this is not something happening this year or next, but it's that future state where they're really looking at how do we make that as person-centered and just easy to use and friendly as possible, and really looking at that life course. And then I would say this middle one is actually probably one of our most preliminary components that's going to continue forward. And that's our organ needs assessment. That's that one assessment tool for everybody that has that, again, person-focused design, really focuses on support needs and aligning supports with people's needs and matching them up, and also having that kind of portability between services. So instead of previous, where if I was in foster care, I had one type of assessment. If I was in 24-hour, I had another. If I was in home, I had another. Again, this is just kind of combining and streamlining and making this a more simplified process. And then we have our service group framework. And that's really where we emphasize today with exceptions and payment, is that service group payment. So in the following section, we're going to talk more about the exceptions when we talk about that context of service group framework. Our 24-hour residential service exceptions and implementation timeline is really as follows here. It's a very quick and intense snapshot of time if we really want to look at that. We're going to begin accepting the submissions for those exception requests for that anticipated or expected implementation date of July 1st. And when I use the word anticipated, I mean it is happening. I don't want to get anybody's feathers ruffled that we're switching or changing. That's a solid go ahead date. But we really looked at what is our time frame for when we take that action, specifically looking at exceptions and making sure that we have those exceptions submitted, reviewed, and authorized in time for that July 1st implementation. So we have a window of April 1st to May 31st, where we're prioritizing those exception requests. And what that means is if we have an exception that's submitted in that time frame, we're committed to having a decision in place so that that new rate can implement July 1st. We'll still continue to take exceptions that June 1st or later. We just can't guarantee that decision just looking at our volume and resources. But we actually have hired and brought on a whole team dedicated specifically to exceptions so that we have the manpower and resources to respond to the requests that are being submitted. So again, we have that concentrated effort. And part of the reason why it feels so condensed is because with exceptions, and when we talk about service rates and service systems, we have to talk about like live time, in this moment that we're talking about support, it has to be accurate and reflect someone's current support needs. And that gets really hard because over time, changes can happen and there can be slight fluctuations and adjustments. So we really had to look at kind of all of these competing resources, as well as where is the individual at when we're looking at their exceptional rate and how do we ensure that that is a current and accurate picture that we're then implementing on that July 1st date. So we do acknowledge it is a really intense timeline for folks, but it is with intention because we need to look at the integrity of those decisions and making sure that it's an accurate of a portrayal of someone's support needs and resources that match for that implementation. So when we talk about the exception requests, the why is fairly straightforward. Exceptions are in place when someone has needs that exceed the resources that are available to them. We want to make sure that people have the support they need for their needs to be met so that they're safe living in our community settings. The exception process really exists for people who have an assessed support need that requires a greater amount of that direct support staffing in most cases. We even call it an actively engaged support staffing when we're talking about 24-hour settings. But it's basically somebody needs more support than is available as a resource that's able to be available to them based on their service group or payment category. And it's necessary for someone's basic health and safety. So exceptions include typically kind of four main components. Maybe somebody has exceptional behavior support needs. So it's really, there's an acuity and intensivity of some support related to a behavior challenge that really requires some super intensive staffing or some level of extra professional support. So that's one category. We have exceptional medical supports as another one. And this might be an individual who, again, has a very acute medical condition, and maybe they need some really intensive hands-on intervention or treatment or support related to their medical condition. In some cases, you'll have that behavioral support need and medical support need. And again, that just makes it a real exceptional situation. There's also going to be situations where somebody has a direct care staffing that's just needed in a greater amount. Maybe there's something unique about this person's support needs where an example would be maybe somebody who has some pretty involved support around eating, and there's some great aspiration risks, some choking risks, and there's just a really involved, very engaged routine with eating that takes up really hours upon hours of their daily support. And that's really exceptionally beyond what is more typical in day-to-day community living when we think about support around a mealtime. This could also be situations with mobility and other support. So it's not necessarily that there's a big challenging behavior or some type of acute medical condition, but this is just a situation where something about this individual situation or condition requires some very, very involved staffing support to make sure that they're healthy and safe in those activities. And then our another category we have is really that more than one staff. This is when we're thinking about 2-on-1 or 3-on-1. And this is really we're saying that 1-on-1, or I mean, I'm sorry, that 2-on-1 or that 3-on-1 is needed in such a way that we can't just rely on maybe that resource of in a shared living situation, a staff kind of stepping in those moments here and there. This is a really engaged second staff who just has to be there kind of on duty, ready to respond, or actively providing support during that care time. So really to recap, we have exceptional behavior, exceptional medical, some significant engaged direct care staffing for a task or multiple tasks. And then also when we need more than one staff to provide that support, such as a 2-on-1, 3-on-1 plus. Now we're going to look at that criteria that kind of falls in with these areas. We've kind of talked about where that the why, and this is kind of the what. So the support need a person has to really meet that criteria of what makes it an exception is really all of these following. The first is that we have a specific condition or need for support. So again, going back to that last slide of the why, what is it that the person needs? Why do they need this support? What support is needed? That's what we're getting at here. The second piece is that this is so significant that without that extra support, we're looking at serious harm or need for long-term institutionalization. Now, I will say, even as we develop this training, we know that those words can be very triggering for people and have a lot of emotions involved. But when we talk about exceptions, we're really talking about, again, I keep using the word acuity, but it's very important. It's an acuity, it's an intensivity that is so great that someone is at risk of not being able to live that community life. And when we talk about that institutionalization, we're really talking about maybe a medical hospital, a state hospital, incarceration. We're talking about really, really significant safety and harm jeopardy. The next kind of criteria we have is it's expected to last 30 days or longer. So when we talk about our payment categories, there's still kind of a range, and it's that average in that range. We realize that everyone's supports are not going to be prescriptive, and every single day they're going to need the exact same amount of staffing. We understand that there's fluctuation throughout the day, the week, and the month. And we have to have some adaptability. You know, a situation like maybe somebody gets COVID or somebody gets, strep throat or something that's in most cases a very temporary illness that maybe requires some more intensive support. And we realize that kind of counters with those times where someone might need less support. Maybe they have a family or relationship network where they're stepping away from service a little bit and not quite needing the same level of funded support. So we realize there's some flexibility. But when we get to that range of at least 30 days, we're kind of looking at this of, is this kind of a new normal for this person? And we absolutely want to ensure that the resources are available when there is that exceptional situation. And then lastly, it's unable to be met through available alternative cost-effective services, supports, or natural resources. So somebody might have that increased significant need. It could be, again, a situation where it's a dangerous or harmful situation, and it is a long term. But maybe there's a family member who's very involved and actually provides a lot of natural support. Then maybe there isn't a need for an exception so much as their plan identifies this intensive support. It's an exceptional level of support, but it doesn't translate to exceptional funding. At the same time, we definitely want to have that information documented and established. So perhaps that natural support is unavailable or steps away, and there is an initial funding need. Maybe there's that staff that needs to come in and take that place where that family member previously was a natural resource. So we want to make sure that, again, we're not closing doors, but we're also acknowledging if there's other alternatives, such as a natural support, or maybe there's an alternative such as a technology or some type of modification to the environment that effectively helps address the situation. We always want to look at those before we kind of put more bodies on somebody, because in most cases, when we're talking about exceptions, particularly 24-hour, we're going to be very focused on staffing when we talk about exceptions. So provider rate exceptions are, again, something that can be appropriate for multiple settings. So we have rate exceptions, which means the compensation or the funding available to the provider needs to be an amount greater than what is available through our standardized rate setting process. So these apply to our 24-hour residential homes and our host homes, supported living in the way it's currently structured, employment services, hourly attendant care. And when we're talking about the attendant care, we're not talking about volume of hours. Again, we're talking about a rate associated with the attendant care provided by a provider agency, as well as relief care. Similarly, this is going to be a provider agency that needs a higher rate to make sure that there's the available staffing resources and supports for someone to be safe during the delivery of that service. And this is very specific to agency, provider agency rates. So we do not have provider rate exceptions for PSW wages or adult foster care. And this is particular because those rates are collectively bargained and subject to that agreement. So we can't make exceptions to those. Now we're going to go ahead and look at an example. And we have Nadia's story. Nadia is in a 24-hour home, and she's recently had some surgeries, and now she needs support pretty much all of the time, like an active support providing her care, and for the next 3 months. So her service group, which is then her payment category, is not sufficient to meet those needs. So she normally would have a lower payment category based on her service group, but because of this convalescing that she has, this healing time that requires more support, maybe there's a lot more about bandage changing, maybe it's also some behavioral intervention so that we're keeping her from removing the bandages or picking at wounds or anything like that. It could be some physical therapy components, all of that. But her service group, that payment category associated with service group, is just not going to be sufficient for those more intensive needs during that healing time. So her team meets and they look at what are the resources we have and what is needed. And as the team looks at this, they're saying, you know what, she really needs an exception because we need to make sure there's enough humans in place, some staff there to provide her that support to meet her needs that are going to be increased over this time. The services coordinator is the one that's going to complete and submit the exception. Now, this process we're not fully dictating, so how that exception request gets completed is really up to that team as far as gathering the information and documenting it. But ultimately, at ODDS, we hold the responsibility at the level of the services coordinator for being the one that makes sure that that request is completed. And they're the person, that source, that role, that then submits the exception request to ODDS. The provider will be CC'd on that and a part of that, but we want to make sure that that's clear about roles and responsibilities. And then after that request is submitted, ODDS approves the exception, and it's for a 3-month period. And now she has those supports that she needs to keep her healthy and safe. So when we look at how the exceptions are kind of calculated, again, looking at the 24-hour kind of world of things, we're looking at those direct support professional staffing hours that are going to be beyond what is assumed in that payment category. So one of the things that you'll find is our rate setting actually has kind of a breakdown and assumptions of staffing. It's not an exact science, but we're really saying that somebody needs some direct care support that is really clearly and significantly above and beyond what would be accounted for in that model. So if we kind of look at, we have a visual here that kind of gives you an example of how we get there. We have a payment category rate. And again, that rate is going to have some assumptions about staffing support in it and those hours available to provide support. And then we have what we call an add-on, or it's the exceptional rate. And that's really the difference between the payment category and the total support someone needs so that we get them to their new exceptional rate, which funds those increased staffing hours. So let's look more at the process and kind of have a better picture of how we can provide seamless supports to people when they need them. Starting with the exceptions process involving the ISP team. So first we look at the ONA, and that's always going to be step one. So we have a situation where there's an exception that's identified. We need to go, hold on, stop, wait a minute, and look back. Does the ONA reflect the person's current needs? If the answer is no, we're going to go back to the step of ONA completed, which means we need an updated ONA completed by a certified ONA assessor, making sure that we have, because the ONA basically establishes the service group and payment category, that the ONA is accurate and that the resources are available through that payment category. Once that's affirmed by the team and they're looking at that planning component, we're saying, okay, we have the ONA, we are aware of what's available through that ONA, but we still have a gap in need for this person's support needs. We want to look at what are alternatives, how do we meet those needs? And then if through that process, we say, you know what, we still need an exception, that's where the team is then going to look at affirming kind of steps and information, which is again, reviewing the ONA, working with that assessor to make sure that things are accurately captured. What's the reason behind that exceptional need? What are those alternatives? So again, we have the ONA, the planning, and through this, we're really reviewing these components here and establishing that information. And then, as I said before, that services coordinator or personal agent is going to complete and submit that exception request to ODDS. And we'll talk more about the form in just a little bit. So then if we look at the next kind of process, it's kind of a parallel concept. We have our ODDS process of what we're doing and how we're interplaying with our case management entities. So we receive the exception request and we have some kind of internal reviews. In between kind of box 1 and box 2, we actually have a receiving party that's going to be reviewing to make sure the form is completely filled out. If there's any documents that should be required, that they're there, and communicating if that isn't, saying, hey, great, we received this, but we need a little more information, or did you realize you missed maybe completing this section? But if we have a complete exception, then that exception goes to our exception committee. And the exception committee is going to review that request. Again, looking at that criteria we talked about earlier, which is what is the exception for, why is it needed, and are there any other resources, and taking that information from that exception form and then issuing a decision. And then if that exception request is approved, that service group plus add-on is going to be then put into plan of care. So looking at the roles through this process, again, to be really clear, you'll notice provider, you're kind of like the first line, because you guys know probably better than anybody what it takes to support somebody. You understand the reality of what the support looks like day to day. So you're making that request to the services coordinator, or in maybe non-residential services, it's the personal agent. And you're providing that information necessary for that request to be complete. So you're really informing the process to a great degree. You are the keeper of much of the answers. So we need you guys, and your role is very important. The next role we have, of course, is that service coordinator or personal agent. And again, they want to start with that step of looking at the ONA. Is it accurate? What's that need for the exception? What's being asked for? What alternatives are looked at? What are other ways to look at the situation? And then they're going to be submitting that exceptions request, as well as providing additional information to ODDS. So one of the things that we'll find as we've updated our new form is that we've really tried to streamline, and we've really tried to ask targeted questions so that it's not this back and forth that can be very timely, both in the amount of staff time utilized as well as time frame to get a decision. So in most cases, submitting that form should be enough information for a decision to be made, but there's going to be those times, it's the exception to the exceptions, where perhaps there's going to be additional information, and we'll want to make sure that that services coordinator and personal agent is engaging with ODDS and getting that follow-up information. And just again, a note, residential providers, we're keeping you involved in this process, and you will be CC'd on those submissions because this is all an electronic process. And then ODDS, our role is to review the request, make a decision, and to give that notification. And in the instance of provider rates, that notification goes to the services coordinator or personal agent and the provider. So now we're going to talk more about the form, like I was kind of mentioning and previewing, and we want people to be familiar with that form and kind of how it's going to be more efficient, hopefully. So we kind of have some new features of this updated form. It's been a very involved process, but one of our number one goals was to have one form for all of the exceptions. So instead of an individual who might need an exception for professional behavior services, residential staffing support, employment support, maybe some type of assistive device, that was 4 different exceptions, compiling all new individual forms, copying off what's filled like half or most of a case file and submitting it to ODDS for them to ask more questions and the back and forth. And so we started with, we have one form and you can indicate as many exceptions as you would like that's relevant to that person and their situation. And also it can be kind of a living document. So maybe I start with a residential exception and then I'm adding some more professional behavior services. I can use that beginning document and add the professional behavior services and those couple targeted questions that give that information specific to the behavior request, and it all gets submitted, but it's more streamlined. The questions are more targeted. This is part of what's made this form take so long in coming, is there's a whole lot of programming behind it where it's a very interactive form. So the questions are tied to what type of exception I'm requesting. So hopefully, whatever I'm answering in that form by clicking specific boxes based on like where someone lives and the type of exception I'm asking for, I'm really only answering questions that seem relevant to that type of exception. And again, there's that less back and forth. The other thing we're really trying to do with those targeted questions is really, it's like, give us a summary, give us a picture. We just need a picture of what that situation and support need is so that our exceptions team can look at that based on that form, make a decision. So again, there's not this, 200 pages being submitted and sent via email and these documents, opened and they're hunting for information and they find a sentence here in a behavior plan and there's an evaluation over here. And then there's all these tracking data pieces and they're flipping through 20 pages. We want a summarization. Again, give us a picture that tells a story. And then there's going to be less documents that are submitted. There might be a couple supporting documents that are asked for based on the exception type. But again, it's not if I'm a case manager and I'm preparing this exception request, maybe just to be sure, I'm sending them like most of the file because I just want them to have everything and they can figure out what they need. This is, again, getting a clear, clean process for us to have that best interest of everyone's time and information of here's what we need, here's the why, and let's move forward. So those are some of the features. How you'll find the new form is going to be on our ODDS forms server. It's 0514 is kind of like that form number. So it's like a DHS 0514DD. But anyway, the number you need is the 0514. When you're on our forms page, you'll see this not so pretty box table design here. And really, honestly, I don't worry about any of the lines in that table other than the publication number. If you just put that number in, you've got it. Now, again, if you're working and you're like, oh my gosh, I can't remember that. Was it a 5144126? It's okay. There's also other options where you can have, and towards the middle, it says title contains word or phrase. This is just a little more difficult because you kind of never know what you're going to get. But if you put something like ODDS funding review or exceptions, it should get you to that form. It's just not going to be as targeted. So you might have, it's like guessing the right words to put in, or you get this list and then you're like, oh, I think it was that one. So if you can remember the form number, it's going to be the most efficient way for you to access the form. But there are some other search options on here as well. But like I said, most of these lines aren't something you should even worry about. But this is the way that you want to get there. And every time you're starting the form with an individual, please go back to this search box and pull up that form that way. That way, you know you're using the most current version. I don't anticipate changes for a while because it took us months upon months to get this form built. So it will take a lot of effort and some significant overhaul for us to make an update right away. But just to ensure that you have that most accurate version, this is always a great way to start. And I would say that's kind of a general rule for most ODDS forms. So what does the form look like? I almost want a drum roll for this part. This is kind of the start of the form that has some general demographics. So the top of this form is where you're going to see some basic information. We do have a request date. We do want to indicate, is it a new request or a renewal request? Now, for anybody who has an exception prior to 7/1, that's like an active exception, and then they're going to need a new exception even with the new payment categories, indicate renewal, please. That just lets us know that we previously approved an exception for that person, and that's really important for us to see. There's a couple targeted questions about that that really talk about what has changed or not to make that a more expedited review. And then again, a lot of this is going to be some straightforward information. We do want to indicate if it's adult or child because some of the services or questions are going to be targeted a bit, especially if that child box is indicated. And then, of course, if we have a parent or guardian in place, we want to have their information. So one of the updates with this form too was us getting the contact information that we needed on this document. And then going to the next slide, after we have this kind of beginning section of demographics, and there's a few more questions than were snapshotted there, but they're fairly straightforward and hopefully easy to find information if you're working with somebody actively. And this is an example of some of the types of exceptions. Now you'll see this goes up to number 32, but you'll notice there's not 32 lines here. And this is just a snapshot to kind of show you how the interactive form works. So if on the first page in that demographics section, one of the questions you didn't see was setting where the individual lives or will live at the time of the exception. And this one reflects somebody who had their box clicked as an adult in a 24-hour setting. And this basically then sorts what type of exceptions could be asked for someone living in this exception, or this setting type. So for example, you're not going to see something like a child foster care rate exception or a 2-to-1 in foster care, because those are services specific to a different setting type. So again, we're kind of looking at that streamlining. And you can indicate as many of these that apply to that person, and those questions will pop up that are specific to that service. These question boxes are just clarifying language. If you're like, I wonder what that means, just click on the box and it explains to you what that type of exception request would be asking for. And then we have some documentation pieces. Again, this is just something to kind of show you at the end after those targeted questions. Depending on what type of exception you've requested in some of those documents, there's kind of like a checklist to guide you with what needs to be submitted with this exception request. So for all of our new requests, pretty much you're going to have an ISP. And that again just gives us that kind of snapshot for that person. That's our best reference document outside of that summary questions that you're answering in the document itself. And then, for example, if you'd indicated it was a renewal, we're going to see what was that a previous approval. And if that previous approval had some type of specific requirements with it or some type of condition, we would want to see that additional piece. And that really comes to play with oftentimes, for example, if we had a PSW work week hours that exceeded the CBA limit, that's going to be something where we want those job descriptions, like kind of show us your efforts for how you look to try to find other caregiving resources. So that's just an example, but that's a quick snapshot at kind of what the form looks like. The form is going to be available very soon. Our publications is finishing touches. We've been doing a lot of work trying to break the form so that we can make sure there's no glitches or issues once it's launched and available. Again, that new exceptions form is something that's going to be available to use beginning in April. So as soon as we make it available, we want people to be able to use it, but we're really targeting that April 1st, which is just around the corner. So now that you've seen the form, we also want to kind of help you understand how we're calculating those exception rates. So this is trying to give you some more transparency around how do we get where we're at when we say, yes, you're approved, and here's what you get, or here's what's funded. So when we look at the exceptional rate calculation, and again, this is very much focused on 24-hour, but we're really looking at what we keep calling actively engaged 1-to-1 or 2-to-1 hours. This is those manpower hours where someone is on and available to help support somebody throughout their day-to-day activities and support needs. So this next slide is going to kind of help explain what we mean by actively engage. So it's not just that we have staff on, but these staff are like one-on-one. They're tuned into this individual. They're assigned to the person, and they're continuously, again, when we say engaged, we're really talking about the staff and their focus on the individual. So it doesn't necessarily mean that the individual has to reciprocate. We want to make that really clear, but it's really about the staff themselves. They're on that high alert. I always kind of talk about when we think about physically engaged, and kind of make the comment, staff tend to wear track shoes to work. Like they're ready, they're moving. Maybe they're doing a lot of strategic positioning and modifying of the environment and doing a lot of physical cueing. So again, that's what we mean by that engagement or mentally engaged. That's kind of that hypervigilance where I am so like mentally in tune to watch for cues and watch for potential stimulus that might trigger a behavior or a danger to this individual. And I'm actively just ready to jump in and respond. And these needs for support are so acute, I can't really be responsible to do other things. This means I'm not cooking dinner and also considering myself mentally engaged for that one-to-one support. I'm not responsible for some of that household maintenance activity, or I don't have an ear out for another household member. I'm like on, and my job is supporting this individual, and that's really all I can do because of the intensity of support needs. So how we calculate the hours then? So let's say we've established how many hours somebody needs. And in this one here, we're going to talk about a situation where somebody might need that active 24-hour support. Again, these situations are, in general, when we look at the picture of people we support in our services, are pretty rare, but we do have situations where someone needs a 24-hour person that is on and actively supporting them. So the first thing we're going to do is with step one is first look at what that shared staffing is in our rate model. So we're kind of going to do a visual math. If you're like me, I'm very visual, and this is how we calculate things. So this is a made up rate model. This is just simple math because I'm not a good numbers person, and we wanted this just to be more about the concept for you all. So don't try to take these hours and translate them exactly to our rate model. It's not going to work. This is for example purposes. But let's say in this example, our rate model assumption for this person and their payment category is it says 16 hours of staffing. And if we look at that rate model assumption, we're looking at the 16 hours. There's 8 hours of what's called a shared staffing contribution. This means that 8 of that person's 16 hours are really dedicated to ensuring that there's at least that minimal presence of staff. There's at least one staff on for the home to respond to everybody in the home. So what we want to do when we talk about that one-on-one, because exceptional hours are always going to be one-on-one hours, we want to take away those shared staffing contributions that doesn't count. Because if we have the shared staffing and we're expecting that for the one-on-one, then who's providing support to the other people in the home? That takes away that resource from others. So what we're saying is our rate model is going to assume 16 staffing hours, but we'll take away the 8 that are shared and counting those one-on-one hours to ensure that there's adequate support for both the household as well as the individual. So 16 minus 8 equals 8 hours. So we know that we have 8 hours essentially of one-to-one in this person's model. Now, if we look at, again, the example we said was going to be someone needs 24 hours of that one-to-one actively engaged support. So we start with our 24 hours, and we can take away the 8 hours that we said was part of that rate model. So they get 8 hours of that dedicated one-to-one already. We're going to minus that, and that leaves 16 more hours that that person needs that dedicated DSP. So if this exception was approved for that request for 24 hours, that add-on, that exception would reflect the funding for 16 additional hours per day of staffing support for that individual. So after the request decision is made, it's kind of like the what happens next and what does that look like? That's what we're getting to here. The first thing that you're going to get is that funding decision memo. And this is kind of an example. We're still doing some little tweaks and modifications here, but this just gives you a picture of kind of what you're going to see. It's the official letterhead, and it gives you that funding decision. And so this is going to give you information such as the effective date. So when does this start? It's also going to give the decision. So is it approved? Is it denied? Of course, in most cases, it's going to be approved. We usually approve those requests. And then it'll kind of give you the why and the hours of support. So for example, in the 24-hour, it's going to be, reason is for, 16 hours of or 24 hours of one-to-one with 16 additional covered in the exception. If we look at the example we had before. And then we're going to give that service rate. So the service rate is going to capture what is that total amount of support that that individual gets through their funding. What's that service rate for that provider? And then there'll be an expiration date as well. This is something that we're going to have some follow-up information for you all on as well, because the expiration dates are going to feel a little more complicated as we get into this. One of the things that we want to do is acknowledge both the amount of effort and resources it takes with a system change, but also looking at when it comes to a lot of individuals in our service system, supports can then look fairly consistent. And what do we do that's the most efficient way of looking at an exception request? So your expiration date is going to really be one of two options. You're either going to have a stated expiration date. Let's say the example we had earlier with the individual who had the 3 months of healing and convalescent care. For that, that exceptions request probably will have a specific end date that says, it's approved for this period. For another individual who might have ongoing support needs, and maybe it's the same way supports have looked like for this person for the past 10 years, and nothing has really changed for this individual. We know what works, and it's just a whole lot of staffing support. For that individual, what we really have then is this is something that's going to be valid until a situation makes it not valid. And basically that's that somebody has a change in need. Because whenever we have a change in ongoing need, we're going to need a new ONA. So if a new ONA is occurring and there's that change of need, that triggers that expiration, because we need to look at, in reflection of the new resources allocated by the new assessment, does the exception still make sense? So that's really where we're at, or a 5-year maximum, just because we do need to have some look, at least at some point, to ensure not only is the need there, but is the service being delivered, and does it still make sense for this person? Because over time, sometimes people do change, or the supports maybe aren't as intense, and we just want to make sure we capture that. So that's something that's kind of a new concept, is more of a situational expiration that's going to happen in the vast majority of these exceptions that are being approved. We do require an annual review, but it's not going to be something that we're doing at the ODDS level. This is really that services coordinator when we're looking at annual planning. So it should really coincide with the ISP, but we want to make sure, does the person continue to need those exceptional supports? Sometimes when exceptional supports come in, they really provide structure, stability, and routine for somebody. And then maybe through some strategies that are implemented, we have some skill growth, and we're able to then kind of walk back some of those intensive resources. And then we also want to make sure that if it's being funded, that additional staffing is being provided. If in that second category we say it's not, then we say, what's going on here? Do we have an unsafe situation, or is it actually like that first box, that maybe that need isn't quite as intensive and maybe that exception isn't needed, or we need to make an adjustment to that exception? So again, we want that annual check-in just to affirm, yes, it's needed, and yes, the person is receiving those supports. We really want you to think about the exceptions process as kind of a continuous thing in many circumstances. So we always start with that change in need. If there's a change in need, that means a new ONA assessment. If you feel like I've said that 5 times already, I probably have, and it's very intentional, because we always want to start with the assessment tool and look at that as our foundation of resources for that person. So is the assessment accurate? The ONA assessor is completing it. And then when that assessment is done because of a change in need, we then need to evaluate, is the exception still needed? If it is, then that request goes to ODDS. So then you have the blue box and things are fine and dandy. But if we go back to that change in need, oh, something has changed in that person's life, situation, or support needs. We go, okay, there's a change in need. Let's make sure the assessment reflects that, and then go from there. And do we still need an exception after the new assessment? So again, it can be very circular. At some point, maybe somebody doesn't need an exception anymore, and that's fine. Then you go back to, okay, whenever there's a change in need, we have the assessment. Does an exception need to be requested in light of what resources are available? So it is continuous, but if you'll notice, some of that situation dependent expirations should hopefully lessen the frequency of this cycle, especially for people who have maybe intensive needs, but they're pretty predictable and consistent. So after that change in need assessment, a few things can happen. So when we looked at that box about change in need, maybe with the new rate, that works and that covers it, because that new assessment really matches what that support need is that that individual has. When there's a new rate and that rate increases or stays the same, it's effective immediately. If there's an exceptional rate, then we need to make a new request. And then the funding memo will provide that effective date. In most circumstances, we're going to be able to even adjust the date, for that exception for when that support was added. So in most cases, let's say somebody has a new rate and the new rate goes down, then in that time period between when a new rate becomes effective, so it's immediately effective if it's an increase. If it's a decrease, we give some more time. And it's kind of a difficult way of expressing it, but it's the best we can come up with. And it's effective the beginning of the month following the full month of the exception, or of the assessment. Okay, that sounds like word salad, but I'm going to walk you through it. Let's say an assessment was done on September 15th. Okay, and then that results in a rate decrease. So the next full month, because that was done mid-month, is going to be October. So that lower service rate is going to be effective November 1st, the beginning of the month following the full month after the assessment. In that time frame between when that exception was submitted, assessment, confusing my words, which is not helping, my apologies. In that time between when the assessment was submitted and that effective date of that new lower rate, that really is your best window for identifying and submitting an exception. So if between that September 15th and November 1st, that person still needs the exception, and of course, as a provider, you're like, we're staffing them, we're providing the support because we got to keep everybody safe, that is fine. Then we'll be able to step in and approve that exception so there's no gap in coverage or service. So that's, again, that optimal window where we're prioritizing once we get this new rate model in place. So there should not be any kind of gaps or bumps in service. We just want to really try to look at those timeframes and how we can tie those in as seamlessly as possible. So again, it sounds somewhat complicated, but I think as we get into it, it'll become more familiar with folks. And then that no exception renewal is submitted. So let's say the rate does go down. Maybe it's the minus the exception piece. That's that last day of the full month following is that last amount of exceptional funding that's in place. So if an exception is not submitted, then there is an automated component where that exception will expire. And we'll talk about this off and on. And like I said, there'll even be further communications from ODS to really help with those I call it the dates and rates, but help us understand those timeframes and those timelines. So just a quick knowledge check, because I've given you so much information, but let's think about what information do we find on that funding decision memo. And if people want to put something in the box, they're welcome to do that. I know we've got lots of people involved. Then I know people are still awake. Effective date, excellent. The decision, yep, the approval or denial, the rate. Yes, all those are very key, important information. Yep, the date. Thank you, guys. So those are going to be some big ones. It's kind of the when, the what, the how, and for how long. Thank you, guys. So next, we're going to really focus on what are some of the training and resources so that you can have additional information about our Compass project and follow-up information. And I believe, Teresa, you're going to step in and let people know what's available for them. And then following that, we'll get to questions. Thank you, guys.
Thank you. So we do have a lot of training. Like I said earlier, this is just one of many trainings that we'll be rolling out. I also want to stress that this webinar is recorded and it will be put online on the Compass website that I will show you in just a minute. Every webinar that we've done, regardless of who the audience is recorded and added to that website. So you'll be able to review all of them. So first I wanted to show you the Compass Project website. So this is actually the overview. So if you need additional information, you can go to this page first. But if you look on the menu on the left in the gray box, down second from the bottom, there is a link to the training center. And if you click that, it will take you to the Compass Project Training Center where we have all of the trainings listed. Some of them say to be determined. I want to stress that the ones that are to be determined are for, I'm sorry, online modules that will be available in Workday. The other ones, if you look on the left, it will give you the month that it is available. It will tell you what the name of the training is. It will also tell you when it's going to occur. It will give you a course description and then where it's available. So on the right-hand column where it says audience, if this is for people receiving services and families, there will only be a Zoom link to this. Registration will not be required in Workday. If it is for any other audience or a combination of audiences, it will be registration in Workday. And again, all of those trainings are going to be recorded and available in the past training section. If you look in the menu on the left, there's a link to past training, and then they are just available on YouTube. And so then on the next slide, we've got some links for you guys. This one, the first one is resources for people and families, case managers, service groups, and then there is a link to the rate models. And so if you need additional information, you can find them there. And then we've got the next few slides, we're going to be looking at the actual training that's rolling out. So the first one is the background of professional behavior services. It is slightly related to unbundling, but in general, it's just describing the background and definition of professional behavior services. The actual unbundling piece of it for professional behavior services comes out on March 17th. So again, I just want to stress that the March 1st training is going to be the background and definition of professional behavior services, and then the unbundling billing piece of it is coming out March 17th. Then we also have an ONA training for providers that's coming out, a Compass overview. This is actually we've done this one before. This is the second training that we will have rolled out for people and families, March 16th. And then the unbundling for direct nursing services, that is on the 16th as well. And then another ONA training for people and families in April. In the next slide, we've got additional training. So a Compass overview is going to be available in an online module as well as an exceptions, the general exceptions, which is what you're taking today. An employment specific exceptions training, one for VR. And then these last two rows, these are actually calls that Rose will be, or webinars, I'm sorry, that Rose will be providing on April 5th and 15th. Those can also be found on the Compass training website. And then the next few these are express trainings that will be coming out in May. We'll provide some additional information later. They are still in development. And then the last slide for training, again, this is on how to authorize and bill for employment, transportation, group homes. And then it says phases. You don't really need to know what that means, but this phase 2 is going to be a webinar. And so eventually phase 1 and 2 are going to be combined and available, I believe, starting in July. So it will be a module combining these two. So let's move on. So if you have any questions, so if you're a provider agency, please contact your services coordinator if you have any questions about exceptions. And then if you are with the CDDP, you can contact Rose Herrera, who is your subject matter expert today, or Abby Kinky, and both of their emails are here available for you. So let's talk a little bit about the learning outcomes that we discussed at the very beginning. These are some of the ones that we had set up initially, hoping that you would learn this information today. And the reason that we're reviewing them is that if you have any questions related to any of these, we are going to have a question and answer session next. And so that will be the time to ask these questions. So just a quick review, we talked about the time frame for exceptions to be prioritized by the July 1st date. We identified the steps in the exceptions process, key aspects of the new exceptions form, how exceptional rates are calculated, and then we identified some components of the funding decision memo. So keeping that in mind, we're going to move to the question and answer session. And there are a couple ways to do this. What we found is most useful is if people either raise their hand and then we can call on them and ask them to come off mute, or feel free to put your questions in the chat and I'll read those off and then Rose will answer them. And again, if there is anything that we're not able to answer today, we are recording the chat, so we will be capturing the questions and we will answer them either in an FAQ or in a future training. So Rose, are you ready?
I am here.
Okay, so the first one is from Carol. It says, I can get an agency service group report from Express. This report shows the person's category, but it does not have the behavior designation. Is there a way to find this information within Express as a group? My understanding is that persons with very high B category will have a higher number of standard professional behavior services hours.
Yes, I believe this is something we've requested from our developers because that was brought to our attention that people would need to know, is the B there, especially if we're tying it to those additional hours. So my understanding is that is something that has been requested and should be available in the future. But I've already written a great big note here and I'm going to follow up with our internal team to make sure that that is in fact in the works. But it is my understanding that that is an intention for us to have that transparency.
Perfect, thank you. Okay, so Netta says, for a person living in their own home, a brokerage client who currently has 2-on-1 special rate, tier 7 for employment and DSA, what will change 7/1 of 22?
So our employment service rates are going to be adjusted based on exceptions there as well. I believe there is an exceptions training specific to employments that's coming up as well. I'm less versed in their area of expertise, so I can't go into too great of depth. There will be some change, as well as I'm guessing a new exception that will need to be submitted. And I did put my, and Deborah did too. My email is there. I do want to just note, it's not that I'm not available to providers, it's just there's a lot of y'all and there's one of me. And oftentimes if we can use our CDDPs in the process, it helps them be aware of what might be going on with you guys at that more local level, as well as for us to just be able to maybe answer once or twice versus 10 times. We also try to update information based on questions we get. So I am available, it's not a closed door, but we do want to try to involve our county, our CMEs first.
Perfect, thank you. So there was a question that Netta had earlier. Is this, in this example, there's a change of need that will likely last over 3 months. Should it not require a new ONA first?
Yes, in most cases, we want that ONA first. I kind of skipped over that, so good catch. We definitely want that ONA assessment to reflect someone's needs. I think in some situations where it's a very temporary situation, but is outside of that 30 days, we would want to consult with our ONA kind of folks in that ONA team to make sure if we said, we are absolutely 100% confident this person's support needs are not going to change past like this healing period. Do we need a new assessment or do we basically look at an added exception? And we would want to go ahead and engage them with that. But in a lot of circumstances, we would want to recommend that new assessment just because we don't always know. We can hope and anticipate that someone's support needs are going to stay the same, but it may be likely that there's some updates along the way for that person. So again, it's kind of a little bit of an it depends, but you're right. When we see a change in support needs that's more than 30 days, that kind of is a new normal. And we want to definitely have that ONA in place first. So again, looking at, will that give us the resources we need? And then if not, asking for the exception on top of it. So good catch, good point.
All right, thank you. And then Christy asks, who is going to alert the provider agencies of the new rate model?
So the new rate model is something that's already available and out there, and that's been part of our Compass communications. I'm going to see if I can quickly find a link to our rate model page. I know I've put it in other trainings and situations that we've had. Let me just take a moment here and see if I can find the link that I can copy and paste for you all quickly. If you are like me, I tend to have a lot of tabs open until then my computer gives up and I have to restart things and I lose my little quick references, but I'm going to do a quick just link to the ODDS Compass page. And that's going to give you guys the link on there towards the middle of the page that provides you with the rate models. So that is something that is published. So if you go to our Compass project page, you can either just do a Google ODDS Compass, or if you go to our rate model page, which is what I'm going to link here in the chat, the beginning of the page gives a table with our service groups and payment categories. And just under that table, there's going to be a link for those rate models that gives you that. There's also an exceptions training video. It's a high level. It's very similar to this training. And that's also another resource. And I believe this training also will then go onto that page.
Perfect, thank you. So Lorelei has a question. When the exceptions committee needs more information, will the provider be included in the request for information? If no, how do we know if what the service coordinator provides fully captures the needed information?
So yes, you should always be CC'd on that communication and information. Another thing that we're implementing with our exceptions process that's kind of new and didn't really make it in this presentation, but it's a sort of called the NOPS form, NOPS. It's a notice of pending status. So essentially, if we get a form that's submitted, maybe there's a section that's not complete, or there's a piece of document that wasn't included in that submission. One of the first things that's going to happen is we're going to communicate back to the CME, and this form is going to identify that notice of pending status, which basically means this exception request goes into pending status. While you get this additional information, we're going to kind of keep it live for this limited period of time. So you're in the queue. We just need to get that information from you, and this alerts you to that and what information is needed. And that's something, again, that we would CC providers on so that you're aware of what's being asked for and kind of where's the status of that exception.
All right, thank you. Lorelei has another question. Will notification letters go to the individual's group home or the provider's office address? Previously, it has been a challenge when letters go to a group home and don't make it to our billing staff.
So my understanding is that the letter is going to go, well, actually the notification should be in most cases electronic via email. So it should be whatever email is provided on that exceptions form. Those should be electronic in most cases. In situations where we do have paper physical ones going out, it's going to be whatever address is included on that form. So the exceptions form has all that demographic information now requested, where I think previously it wasn't. So whatever is provided to us is where that information is going to go.
All right, great. And then there was a question earlier about the size of the form.
Honestly, that is a great question that I do not have an answer to. I'm not a good when it comes to the technical pieces. I don't know. It is a big form. I know that with the drafts that are given to me by our publications, where I look at it and say, is everything there? Is something broken? It's coming through an Adobe format, but I have no idea on the size. So that's something I would have to follow up on.
Okay, and then Lorelei asks, what kind of documentation will be required to show the one-on-one exceptional hours are being provided? Paper schedules aren't always kept on hand.
Okay, and just going back to Jeff's question really quick. So I was thinking about his size as far as like bits or bytes or whatever the technical stuff is. I don't speak computer, I'm sorry. But as far as if it's like, what's the actual physical size as far as pages, that very much depends on what type of exception request it is and how long some of those answers are. So the narratives are open-ended, but I mean, if you took the form without all of the behind the scenes skip logic, it would be like pages and pages and pages. But the form is kind of customized for those of you all who are like 80s kids here, it's kind of like that choose your own adventure. If you click on this, you get these questions. So again, the form isn't going to be excessively long in most cases because the questions and whatever is there is relevant to that exception request. So I hope, Jeff, I've kind of answered that in two ways. And it comes to if it's the technical size, I got to find that out. If it's the other size, it really depends on how many different types of exceptions might be being asked. And I'm sorry, so going back to the one-on-one for exceptional hours, I think was the next question. So one of the things that we do ask as a targeted question to form is to give us a summary of how that staffing looks for that home. What that does is that really helps us to get a sense of what are those existing resources and how are they being structured at current situation to help us get a better picture. As far as to show the exceptional one-on-one hours, that's going to be more of a we don't have a specific, it has to be this way or that way, but whatever it is, documentation wise and information wise, that is going to be clear as evidence that basically the service is provided like it's being awarded or funded. I also want to kind of add a clarification that I think we did in one of our last trainings as well. And with a rate model, we have the kind of hours and the math, and it's a little more cut and dry, black and white. But in reality, if we think about our rate model, we understand there's some fluidity there, and we don't have any intention or plan of like going in and policing hours. We understand there's a lot of flexibility that occurs day to day, week to week, month to month, and we're going to see some of that. When we get to the level of exception, though, we do want to see a more consistency as far as that essentially over the course of maybe it's the day, maybe it's the week, but or it's the month, those support hours are fairly consistent with what's being funded. So there is that level of accountability. But again, we don't want people to come in with clipboards and auditing and, oh, but gotcha. It's not that sort of thing. It's more of a, we do have to have some checks and balances, but we also understand that there is some flexibility and some functionality with having that flexibility in our system.
Great. Thank you, Rose. The next one is from Christy. Who is going to notify each client or provider of specific changes to each client's rate to know whether to ask for an exception?
So my understanding is that there are like reports that are being generated that give those service groups. So it's going to be service groups, which translate to payment categories. And then it's really looking at, are that individual's needs met under that new payment category or service group? And that's where that kind of question about exception comes in. In most situations, people are going to be experiencing a rate increase as a result of the new Compass model rates. We also acknowledge that as much as it sounds great is not as much of a wonderful reality, because we understand that costs have significantly increased over recent times due to COVID, inflation, staffing shortages. So we understand that. So I'm not saying that as a flippant way, but I'm hoping that in most cases an exception is not going to be needed, but for those it's really looking at those service group reports and then identifying if that payment category is going to be sufficient to meet those acute needs.
Okay, the next one is from Jared. He asks, currently with the CIS process, changes in rates can take significant time to show up in Express. With the ONA being contained in Express, will exceptions automatically roll in once approved?
So I believe it's going to be quicker. And then the exceptions are there's like an entry process on our end for those, what they call them add-ons. But that's something that's been kind of a streamlined process that occurs kind of simultaneously with those notifications. So there shouldn't be any delays, but I'm going to do a follow-up on this question just because I'm not as involved with the Express components. And just see, is there similar timelines? Is it more efficient, like you're saying, because the ONA is an Express, which I believe it is, but I want to be sure on that. So I'm going to do some follow-up with our Express team on that.
All right, and so then let's see. Matt said there are a few questions from his supervisor. Okay, so how does the CDDP gauge cost effectiveness in regards to an exceptional rate request?
Sorry, I'm still making notes on the last question to make sure I have the follow-up here on my list. Okay, so how does the cost effectiveness? I think that's a real general thing. We don't expect it to be an exact science, but it's really looking at, is there something in most other alternatives, we're going to see something that might be like a one-time investment. So maybe there is some type of modification to that person's structure or a purchase of some type of device or resource. And so in the long run, as just as a quick kind of almost like a numbers crunch or a look at that, it's using that professional judgment of, I think we have this kind of front loading component we have for this other alternative, and that's going to in the long run lessen the amount of staff or something like that. So it's not an exact, it's really looking at it, engaging, this is through my own professional judgment experience why I think it is cost effective.
All right, thank you. So the next one is from Joanna. Is there a one-page overview table or two or three that simply outlines the number of shared attendant care hours and number of one-on-one attendant care hours built into the rate for each category in different capacity home settings for teams to reference when determining whether a person's one-on-one support needs exceed those assumed by the service group level? Where would we find that?
So if I understand what you're asking for about the hours, the tables, we do have those, and we've actually produced those in some of our other trainings. And that's something that maybe we can look at adding. I don't know how that might work, Teresa, to send out to participants or to link them to our other Compass trainings, but we've actually in those included that table that kind of gives that breakdown of here's the capacity of the home, here's the payment category or service group someone has, and the staffing assumptions with that. So it's something that we have published in other formats in our trainings, but it is something that we can look at also just having as a standalone infographic maybe. So I'll take note of that and follow up with our team.
All right, great, thank you. And so it looks like we have one more. What do natural supports look like in a 24-hour home?
That's actually not an easy question to answer because everybody is different. Every situation is different. So in some situations, we have parents, because I use parents, sometimes it's a sibling, sometimes it's just a close personal relationship, who might have somebody who's super actively involved. So like an example that comes to mind might be an individual whose mom actually comes in and does specific tasks. And that might be part of preserving that parent-child relationship, that connection. Also, through maybe the individual's behavior, they communicate that's their preferred way to get support sometimes. And so that parent steps in and probably gives that maybe second staff role, or even that kind of few hours of intensive support for that individual. And so really, even though that person, if they didn't have that parent, would need maybe that additional so many hours of support in a day, we have that need being met by that parent who's coming in and providing that care at that time. Again, if that situation changed, we definitely would want to look at an exception. We don't want to, that doesn't negate somebody's availability, but we always want to look at, is there a resource available? So it could, again, it could look really any other way. It could be a situation where maybe somebody close to the individual or the individual themselves says, hey, I have this thing I'm going to buy, and it somehow helps me do this activity more efficiently, or it somehow lessens the support I need. And that could also come up in that way too. So it's very hard for me to answer just because that could look so different. We just want to make sure that we're always exploring alternate resources before funding.
All right, great, thank you. So we have another question. Matt asks, how are areas of exceptional need being addressed with the ONA assessors? Will they have the training to document exceptional needs in the ONA?
Absolutely. So our ONA assessors, we call them certified ONA assessors. There's actually a very specific criteria for those assessors. They have onboarding training. They are evaluated on their competency in providing those assessments, and they also are required to commit to very frequent refreshers, basically, so that we're ensuring that not only are ONA assessors well trained, that they're very competent at what they do, and that they remain consistent so that the integrity of our ONA assessment tool is upheld.
All right, thank you. Lorelei has a question. An infographic on the assumed combined hours will be helpful, but please acknowledge these aren't a minimum amount of hours, but rather an average to allow for the ebb and flow. I wouldn't want to see CMEs or teams assuming it was the minimum.
Yeah, great point there. And I really do like the idea of us just having that as a standalone resource for people. If you all are like me, I'm very visual and I love things to reference and go back to. So I am supportive of it, and I definitely would want to kind of bring that forward and advocate for us to be able to do that. And then hourly rates for DSA and employment, I will make that request to our group as well. I am not the policy person for our employment, so I can't commit them to something, but I will ask them and let them know that that's something that would be really appreciated. And yes, the exceptions expenditure guidelines will be also updated to reflect this update as well.
All right. And so Netta says, adding to Joanna's question, can this also include hourly rates for employment in DSA as per service? Wait, is this the one that you just answered?
Yes, I think it is. I was like, I thought I just answered that one. It's
Oh,
okay.
goodness. Okay. And then Joanna, I had another one, found the table listing
Yes.
attendant care hours within the rates. All right. Pages or slides 19 through 20 in the training. Great.
Perfect. Those are, and we did affirm that those are the updated numbers. We had previously done trainings a while back and hadn't had updated numbers. There was a little confusion, and that was been several months ago. But those February visuals and tables are up to date. And essentially, if we look at an infographic, it'll basically be a repeat of those tables. But yeah, the training from the 216 is posted on our Compass website, and you can kind of find it in those slides 19 to 20. And then we'll also try to make that a more accessible source of information. So great suggestion, everyone. I love these presentations and times because it gives us great ideas on how best to support you all.
So we want to give everybody just another minute or so to see if there are any other questions. And then I can't see everybody to see if anybody has their hand raised.
Teresa, while we're looking, can you actually maybe go take us to the slide that has the Q&A or the TA calls? I just want to re-emphasize that. So if you're like me, I can sit through a training or go through a meeting and be like, that's a great idea, and I'm ready to roll. And then I go to actually do the task and I have a million questions. So if you are like me, I want to support you. If you're not like me, I'll still support you. But we do have a TA section. Oh, going back a little bit more, please. In April. Yes, April 5th. And oh, the slide you were just on. There we go. So the bottom two lines of this page here, the technical assistance, they're webinars. They're kind of like our old technical assistance call-ins. This is basically an open forum for you guys to be like, hey, I'm jumping in and I'm doing these exceptional requests. And oh my gosh, none of this makes sense. I have questions about this, this, and this. Please bring your questions. And of course, I'll always be available even before that. But these are targeted times, especially if you have a question that you think others will benefit from knowing. Or if I get the same question for 5 different people, we'll bring it forward on here just because we want you guys to, again, be supported and understand that once you're doing, sometimes more questions arise. And these are just 2. If we find out after 2, y'all need more support, we'll add it. I'm here to support the field and help this transition. And then I see Jean had a question too about the expirations. And yes, we want all exceptions with the new rate model to be submitted with a new exception request. And part of this is because when we look back at all of the active exceptions we have right now, there's so many variables. Some people's amount of support that they have available to them is going to change with that new rate model. That CIS and ONA just don't really line up. Also, for many people, it is going to be a rate increase because there is a significant rate increase for most people or many people with the new rate model. We've also found that over periods of kind of our administrative approach, we have some exceptions that were reviewed on a routine basis, some that weren't. Then we had this little thing called COVID that came in and extended exceptions, and that really kept us from having any type of audit or review in most circumstances. There's just so many variables that we said, really, if we want to look at that kind of, again, integrity and consistent, clean structure moving into our new rate model, we need to make sure that those exceptions requests are actually current and up to date and ready to roll with the new rate model. So we do want anybody who has an exceptions, even right now today, who will need an exception under the new rate model to go ahead and submit that request. And the exceptions can be, again, submitted between April 1st and May 31st is our priority target date. So we'll accept exception requests later than that, but if you want to have that guarantee of a decision before that implementation of July 1st. We ask that you really focus on getting those submitted between April 1st and May 31st. We have a dedicated team. We've actually hired additional staff that their whole gig is really just exceptions, reviewing exceptions upon exceptions upon exceptions, so that we have a responsive system that gives you some timely determinations.
All right, great. Thank you. So, yep, Narina just put in the chat box a link to a Survey Monkey. So this is that evaluation for the course that we were talking about earlier. And it is extremely helpful for us to get feedback from you on what worked and what didn't work, what you might like to see in future trainings, because we will take that information and adjust training that we roll out to you guys and to other audiences as well in the future. So this is really just an evaluation of the course itself and not an evaluation of your learning today, although we do hope that you receive some information on the exceptions process. So we're all going to go on mute and give you guys some time, the next 4 minutes to complete that evaluation. And thank you very much for joining us today. And thank you, Rose, for being our subject matter expert on exceptions.
And thank you all. And I really appreciate all the questions and feedback. Thank you.